Florida's healthcare landscape is at a crossroads, and it's time to take the pulse of the state's policies and politics. But here's the shocking truth. While Florida leads the nation in hospice care, it's facing a nursing shortage crisis that could leave patients vulnerable. Welcome to Diagnosis, your go-to source for insights into the complex world of healthcare policy and politics. Florida's hospice care, a national leader, but challenges remain. Florida is setting the bar high when it comes to hospice care, ranking among the top 10 states nationally, according to a recent report by Florida Tax Watch. And this is the part most people miss. The state's Certificate of Need Con program is the secret sauce behind its success, ensuring quality and sustainability in hospice services. With a hospice and palliative care composite process measure score of 95.9% and a hospice care index overall score of 9.7, Florida is a model for compassionate care. However, controversy arises when discussing the future of the CON program. While Florida Tax Watch President Dominic Calabro praises palliative care for improving quality of life and reducing costs, Executive Vice President Jeff Kottkamp warns that over half of Florida's counties lack sufficient palliative care services. The report calls for a stronger regulatory framework, expanded roles for advanced practice registered nurses, and funding for Medicaid pilot projects to transition patients into hospice earlier. Here's the million-dollar question. Should Florida repeal the CON program, or is it crucial to maintaining high-quality care and preventing fraud? The debate is heated, with some arguing that repealing CON could lead to a surge of low-quality providers, as seen in states without such oversight. What's your take? Nursing shortages, a looming crisis in Florida. As Florida's population grows and ages, the state is facing a critical nursing shortage. The Florida Center for Nursing, FCN, projects a steep decline in licensed practical nurses, with supply expected to decrease by nearly 1% annually, while demand rises 2.3% per year. This disparity could have devastating consequences, reducing adequacy from 85% in 2022 to just 55% by 2037. Registered nurses are projected to remain close to equilibrium statewide, but shortages are likely in certain regions. Certified nursing assistants, currently in surplus, will face severe gaps by 2037. The real issue, as FCN Executive Director Reina Letourneau points out, is the regional disparities in healthcare workforce distribution. How can Florida address these disparities and ensure a strong, sustainable healthcare workforce? In other news, Advent Health is expanding its presence in Florida with a new facility at Wild Oaks, a mixed-use development in Apopka. The advanced ER may eventually expand into a full-fledged hospital, according to Wild Oaks founder Joseph Beninati. Meanwhile, the TGH Transplant Institute in Tampa has been ranked #1 in the nation for organ transplantation, performing an impressive 889 transplants in 2024. As we navigate the complexities of Florida's healthcare landscape, we're left with thought-provoking questions. How can the state balance innovation and regulation to ensure high-quality care? What role should government play in addressing nursing shortages and healthcare disparities? We want to hear from you. Share your thoughts and opinions in the comments below, and let's spark a conversation about the future of Florida's healthcare.